Hey YouTube, today's video is going to be about cancer screenings and early detection. We're going to be talking about different kinds of cancer screenings, what you actually screen for, and how to achieve early detection to prevent development of cancers. If you like that kind of video, keep on watching. It's Wellness Wednesday, where we talk about health tips and facts, and basically I explain health information to try to make it easier for you when you go to your doctor's appointment to help advocate for yourself. April is actually National Cancer Prevention and Early Detection Month. I wanted to talk about cancer screenings. I like our Wellness Wednesday videos to be short and sweet, no more than about 5 minutes, so we'll probably have to split this up into a couple different videos over the next couple weeks. In the USA, the United States Preventative Task Force, or the USPSTF, is a organization that's accredited with making these recommendations on screenings for different cancers, different illnesses, a bunch of different things. The USPSTF isn't solely responsible, however, they do make most of the recommendations that are generally followed. Cancer screenings help us to achieve early detection for commonly occurring cancers with proven testing strategies. The hope is that early detection can help us to treat and even cure these illnesses so that we can maintain a good quality of life and reduce the risk of. There are 5 main cancers that we are able to screen for here in the United States and across the world. The first one that we'll talk about today is mammography or mammogram to screen for breast cancer. Mostly in women, we don't generally have any screening recommendations for routine mammograms done in men, although men are able to develop breast cancer. It's a discussion I would encourage men to have more with their individual primary care doctors about family histories and personal histories or symptoms that they may have for breast cancer screening. The USPSTF recommends that all women who don't have an increased risk obtain a mammogram at least once a year or once every 2 years between the ages of 40 to 74. 75 and above, usually we'll say that you should get breast cancer screening depending on your risk, but we don't always recommend it because the risk versus benefit is not necessarily there. Second cancer I'll be discussing today, and then we'll probably leave all the others for the next video, is pap smears for cervical cancer. Pap smears and HPV testing for cervical cancer. There are 2 types of tests that are involved with cervical cancer screening. A pap smear, where we can collect cells from the cervix, and we'll put those cells under a microscope to look at them just to ensure that the cells have not changed over time to go from normal looking to abnormal looking. There are several videos that I've posted before in shorts, I think, that discusses this a little bit more in depth about the different types of cellular changes. The other part of the pap smear or cervical cancer screening is an HPV testing, where we actually test you for the human papilloma virus. Having the human papilloma virus does not necessarily mean you'll also have cervical cancer cellular change. Having cellular change doesn't necessarily mean that you'll have the human papilloma virus. You can't have one without the other. You can't have both together. Either one of these 2 things can increase your risk for developing cervical cancer. So between the ages of 21 to 29, there is a different screening that's done compared to those who are between the ages of 30 to 65. 21 is when we start cervical cancer screening. So between the ages of 21 to 29, we do every 3 years a cervical cytology. So that's a cellular change testing. We collect cells from the cervix with a swab or a brush, and then we look at it under the microscope. We do that once every 3 years. If your cellular change come back abnormal, then your doctor will talk to you about whether you need more frequent testing, you need repeat testing, or if we might want to consider testing you for HPV. But usually, if it's normal, you just go once every 3 years. In the ages of 30 to 65, what we do is, one, we can just keep doing that regular every 3 year cytology testing where we're only looking at the cells. The other option recommended by the USPSTF is the every 5-year testing. Every 5 years, what we're doing is testing you both for the cytology as well as adding on a test for the HPV. Or we can do the combination of the cytology and HPV together in like a co-test. We have to look at both components of the test once you get older, because as you get over the age of 30 or 30 and above, your risk of cervical cancer increases, or that's just what has been found in the population of women studied in the US. If you have had a hysterectomy that includes removing your cervix, you might not necessarily need a cervical cancer screening, or it's not recommended by the USPSTF, but that depends on what the reasons were that you had the hysterectomy in the first place. So it's super important to, even if you've had a hysterectomy, go talk to your gynecologist or your family doctor and figure out what's happening, what your risks are, and what you need to consider. Okay, so in this video today, we talked about cervical cancer screening and breast cancer screening. Come back, see us next week, and we'll talk about the other 3 screening tests for lung, colon, and the prostate. Stay healthy, guys.
But look at you. Look how far you've come. You faced your trauma.